My name is Joanne Hirth, and I'm a physician here at Henry Ford Allegiance. I practice medical oncology and hematology. I predominantly see patients who have malignancies or cancers. Sometimes see patients also with blood disorders and coagulation problems, which are clotting disorders. The first time I really got interested in treating cancer patients was actually personal issues. So when I was in medical school, my husband actually was diagnosed with a cancer. He's fortunately done very well. He's still my husband and doing great. We have 2 great kids. But when I was in medical school, I saw his journey going through his treatment. Came to respect things from a patient perspective and the difficulties that patients can have getting through a system and trying to keep their life going while they're having their cancer treated. And also a bit from the provider's side. So I have a little bit of ability to see it from both angles, both from the patient as well as being a provider. But that certainly perked my interest to start with. I also found in training that in oncology, you really do have the opportunity to get to know your patients quite well. They're in the office frequently, and I like to get to know them and extend that relationship over hopefully a long period of time and find that very rewarding. I think when you're diagnosed with a serious illness, there's a lot of anxiety that goes into that. And as a healthcare professional, I think one of the best things I've learned to do is just listen to your patient very well. Patients come in, they're anxious, and it's a rewarding part of the patient-physician relationship to be able to dispel some of their anxiety, to let them know there is a path that we can work on together to get them better. And to just see a patient being able to leave with some direction and some ability to look forward and alleviate some of that fear. It's a very rewarding and wonderful part of the job. Patients are seen by the doctors, but when they come to our office and are under a treatment, they also spend a lot of time with the nurses and getting their treatment in the office. Rarely do patients need to go to the hospital. So they're in our office for a while. And in some ways that's really fun. Maybe that's a strange word to use, but a lot of people actually look forward to their appointments. They get to know our staff quite well. We have a wonderful, upbeat staff, and I really have had patients tell me that they feel our office is somewhat a home away from home, and they really foster a sense of community in the office. And so it's enjoyable to see people at ease and really getting through their treatments better because they know that they're providers and they feel comfortable with them.